Hello, good afternoon po.
Sige po, Doc, nasa inyo po yung floor.
Okay, start na po tayo. Sige po, good afternoon. Again, I am Dr. Paola Galvez from the Health Facilities and Infrastructure Development Team, Office of USEC Lilibet David or HFIDT. Welcome to this parallel session on telehealth and telemedicine, one of the 10 sessions under the Hospital Operations track of the first National Hospital Week Research Forum. I would like to acknowledge the attendance of the chiefs of hospitals and medical centers and other officials in this session. The call for abstracts for this research forum resulted in 212 submissions. These submissions underwent a stringent screening and selection process. In this session, we shall acquaint ourselves with three that have successfully qualified for presentation. Each of the researcher presenters in the session shall have 15 minutes to present their papers. After, we shall have 10 minutes to answer questions from the audience. The audience is on mute in the entire session, but you can post your questions on the chat panel of this virtual session room. You can see the button that will open the chat panel at the bottom of the screen. Maximum of one question per presenter will be entertained. Please identify the presenter first, then uh, then you can type in your question next. Before we close the session later, we shall have the synthesis and some onward announcements in the forum program. So, to introduce the presenters in this session, first we have Dr. Danilo Andres Garcia Jr. of Lucena United Doctors Hospital and Medical Center. He will present his topic, the use of telemedicine at times of COVID-19 pandemic, perception, implementation, and evaluation. Our second presenter, Mr. Moalim Kalim Jr. of Cotabato Sanitarium, presenting his study on community-based teledermatology, bridging healthcare access. And third, we have Dr. Concesa B. Cabanayan Casasola of the National Kidney and Transplant Institute to present her study on the development of telemedicine to improve access to renal health during COVID pandemic. To our researchers, thank you for joining this forum and congratulations for reaching this far into this platform and initiative. Let us now start with the presentation of Dr. Danilo Andro S. Garcia Jr.
Good afternoon, everyone. It's an honor for me to be one of the research presenters for this first National Hospital Week Research Forum. Our research is entitled Use of Telemedicine at Times of COVID-19 Pandemic, Perception, Implementation, and Evaluation. I am Dr. Sheila Tan Marino, the Chief of Clinics of the Sena United Doctors Hospital and Medical Center. My co-author for this research is Dr. Danilo Andro S. Garcia Jr. For the introduction, telemedicine is one of the major tools considered to reach the underserved Filipinos now that we are facing this pandemic. Users of telemedicine are usually the physicians who want to see their patients who opted to stay at their respective homes because of fear of COVID-19. However, there are issues in the use of telemedicine, particularly the preparedness of the target users. Since the first quarter of year 2020, the need and demand for telemedicine is increasing, and the concepts such as online appointment, transaction, consultation, and payment has been appreciated by the public. For the background of this study, telemedicine is an alternative methodology utilized to serve patients who are hesitant to go to the hospital for admission or consultation, or with limited mobility because of IATF restrictions. Related studies and literature suggested that user-specific and detailed preparation must be done before its successful implementation. The questions are, is there really a need for telemedicine, especially in Quezon Province? What are the perceptions of the healthcare workers and patients? What preparations must be done? And will telemedicine implementation be efficient? These are the questions that serve as a driving force, inspiration, and motivation for us to conduct this study. Figure 1 illustrates the conceptual framework of the study using an input, process, output, outcome paradigm. It shows that the inputs are the independent variables that include the hospital administrators and private patients. The process is getting the perceptions of the respondents, leading to the output, which is the policy and guidelines required for telemedicine implementation. The outcome is the result of the evaluation on telemedicine implementation. The objectives of the study are the following. First, find out the perception of hospital administrators on telemedicine implementation. Second, determine the perception of private patients on level of preparedness for telemedicine. Third, formulate protocol and guidelines in telemedicine implementation. And lastly, evaluate the effectiveness of telemedicine at this time of pandemic. This study is a descriptive qualitative survey conducted last March to May 2020 for the first phase and June to August 2020 for the second phase. This was supported by the management of LUDHMC and board of LUDI. First, we secured consent from the respondents composed of 37 hospital administrators and 819 private patients. Then, we did an online survey using validated questionnaires. Relevant data were collected and tabulated. The data were analyzed using a 4-point Likert scale, and findings were used to provide recommendations. Consultations with the relevant stakeholders and interested parties then followed. After that, preparations were done and implementation started last June 2020. After 3 months of implementation, evaluation was made among 767 respondents who experienced the project using an open-ended questionnaire. For the results and discussions, Table 1 presents the overall preparedness for telemedicine as perceived by the private patients. It has an overall weighted mean of 2.18 with verbal description prepared. The respondents also perceive that we are prepared in terms of manpower, technology, process, and platform, but slightly prepared in terms of internet connectivity. Table 2 illustrates the perceived benefits by the private patients. They agree that telemedicine is beneficial in terms of its affordability, safety, comfort at home, and it's ideal for follow-up consultation. In Table 3, the perceived disadvantages of telemedicine by the private patients are reflected. It is not ideal for critical cases or illnesses, offers less quality of service, and internet connectivity is not stable. Table 4 shows the suggested platforms of private patients. 80% of the respondents perceive that the Messenger app is best to be utilized for teleconsultation. Table 5 demonstrates the overall possibility of telemedicine implementation as perceived by the hospital administrators. They strongly agree in terms of time and agree in terms of technology and cost. However, they strongly disagree in terms of manpower and internet connectivity. Overall, they perceive that there is a possibility of telemedicine implementation having a weighted average mean of 2.33. The next table presents the major guidelines included on the formulated policy of the hospital based on the results of survey. It includes the availability of online consultation for physicians with clinics at the hospital, using Messenger app as platform, provision of online appointment and payment, and ensuring good internet connectivity. There is also support system for the stakeholders. All of these were 100% compliant. The last table shows the results of evaluation of telemedicine based on survey. The respondents replied that the system and implementation is highly effective, that the online appointment is easy and efficient, and telemedicine at LUDHMC is safe, comfortable, and always available. The most liked platform is the Messenger app, and the most utilized online payment is GCash. The conclusions of the study are the following. First, the hospital administrators perceive that the hospital is not yet ready for telemedicine in terms of manpower, internet connectivity, and the quality of service. The private patients perceive that overall, we are prepared for telemedicine. However, there are factors that needs to be evaluated, particularly the internet connectivity. Third, the benefits of telemedicine are affordability, comfort, safety, and ideal for follow-up consultation, but it's not ideal for critical illnesses and internet connection is not stable. And lastly, the telemedicine implementation at LUDHMC is evaluated to be effective. In the light of these findings, the following are recommended. It is recommended to consider the voice of the customers in telemedicine implementation. It is highly suggested to continue the current protocol and guidelines in telemedicine at this time of pandemic at LUDHMC. Here are some of the references used in the study. Again, thank you so much. Good afternoon, everyone.
Thank you for that presentation, Dr. Sheila Marino. We apologize for having introduced a different presenter initially. Moving on to the next topic. You may begin po, Mr. Kalim.
Si Mr. Mowalim Kalim po ay currently connecting pa rin po. Pero I will play na lang po yung presentation niya. Thank you po.
Hi, good afternoon, everyone. So we are from Cotabato Sanitarium, and we are to present to you our research community-based Teledermatology Bridging Healthcare Access. So together with me is our main author, Mowalim P. Kalim Jr., and us, the co-authors by Nisha Newtandao and Maika Bilintongan. So let's start with the background. Cotabato Sanitarium is a level 1 general hospital with a 100 authorized bed capacity for Hansen's disease and 80 actual bed capacity for general care. With its mandate for leprosy control and prevention management, it must safeguard its catchment area for the possible re-emergence of the disease and prevent it from becoming a public health issue. So we are located in Sultan Kudarat, Maguindanao with 39 barangays, but with only 26 barangay health centers. So it's a first-class municipality and it has a high poverty incidence of 52.3. So it also has the highest leprosy prevalence in Maguindanao, 1.12 for every 10,000 populations. So the Department of Health declared the elimination of leprosy as a national public health problem in 1998. But leprosy has still been a burden among hard-to-reach communities in the country, like the Sultan Kudarat. So DOH aims for a leprosy-free Philippines by 2025. So there are lots of strategies to stop leprosy and its complication. So there is lots of innovative approaches. So we have trainings, referrals, and other sustaining expertise in leprosy, such as e-health. So with that, we have launched the Project Plus, which stands for Teledermatology, Unang Kilati sa Leprosy, Ating Simulan. So it is a private sector supported youth-led initiative aiming to end leprosy by improving the access to healthcare of endemic communities in Central Mindanao through innovation and youth empowerment, starting in the municipality of Sultan Kudarat. So it explored the use of a store and forward mobile technology in increasing the detection capability of community health workers for skin diseases, not just limited to leprosy. So the introduction of teledermatology in Sultan Kudarat is the pioneering telehealth implementation in the municipality and gave the barangay health workers the confidence in assessing the skin conditions of the members of their community. So healthcare accessibility was improved by providing skin consultation services available in the barangay health centers. Next, please. So what is the objective of this research? So the study's objective is to evaluate the feasibility of Project 2 Plus, the teledermatology, through the use of the REAIM framework. So REAIM is the Rich, Effective, Adaptability, Implementation, Maintenance framework. So it's actually a framework that has a qualitative and mixed method approaches. So it helps us understand the complex situations and results that cannot be easily assessed by quantitative measures. It will be explained further by Mr. Malin Tigay.
So REAIM stands for effectiveness, adoption, implementation, and maintenance. So we are discussing shortly about this framework, which answers the question, how do I reach those who need this intervention? While effectiveness, how do I know my intervention is working? For its adoption domain, how do I develop organizational support to deliver my intervention? And then for implementation, it answers the question, how do I ensure the intervention is delivered properly? And lastly, for the maintenance, it answers the question, how do I incorporate the intervention so it is delivered over the long term? So for this research, we use this framework to assess the implementation process of the Project Plus. So it is a tool for research to practice of rural health initiatives. That's why we chose this framework from pre-implementation and sustainability of it. Implementation surveys were used to gather information on the three domains, namely the reach, adaptability, and maintenance. We also conducted focus group discussions through the surveys with the participating barangay health centers. And lastly, the FGD was done 11 months after the training and 10 months after the actual implementation of teledermatology at their respective communities. So the participants were selected for participation based on the recorded number of leprosy cases. So we decided to choose 3 barangays with 3 participants per barangay based on the historical prevalence of leprosy in their community. So we tapped the local government unit for them to identify who these 3 community health workers who are directly involved in the provision of healthcare services in their respective barangay health stations or rural health units. So for the methodology on the implementation of project to class, first is the project to class has three components, namely the capacity development, technology, and access. So for the first component, the barangay health workers were taught on the initial assessment for leprosy and the utilization of teledermatology at the barangay health stations. So we taught them four objectives. First is the history taking and physical examination for healthcare workers. Second, store and forward teledermatology training. Third, referral procedure. And lastly is the awareness campaign. So for the second component on technology, we provided the necessary equipment and other tools for their implementation. So it consists of the smartphones. We provided the end-to-end encryption technology in the form of the Signal app. And then lastly is the data gathering tool, which they will be using during their information gathering and interviews with their patients. And lastly is the access to medical professionals for them to provide patient assessment and treatment. So Cotabato Sanitarium dedicated a nurse and physician who will be receiving the referrals from the community. And also, we would like to take note that there's no dermatologists at Cotabato Sanitarium, but we have Dermalink, which is a teledermatology project by the National Telehealth Center. So for the results and discussion, will be discussed by Ms. Michael Mintok.
For the results and discussion, for the domain of reach, from the 26 barangays of Sultan Kudarat, 3 are chosen to participate in prototyping the project. These barangays are Bulalo, Dalumangkob, and Rodisi. They are composed of barangay health worker, midwives, or public health nurses who were trained for teledermatology conducted by the proponents of Project Class. And for the effectiveness, it improved the ability of community health workers to examine skin diseases at the health station. And note, no dermatologists at Cotabato Sanitarium. Only a dedicated general practitioner physician is assigned for all teledermatology referrals. The physician is also trained of Dermalink, a teledermatology initiative of the National Telehealth Center. So they are dermatologists from the Philippine General Hospital. In this domain, we examined the outcome of the implementation based on the following, and it shows in the table. Implementation of teledermatology at the BHS, letter A. Letter B is total skin-related consultation at the BHS. And for the column C is the total referral through teledermatology. Letter D is total completed consultation through teledermatology. And letter E, which is 100%, all of them were 100%, is the rate of completed teledermatology consultation. And lastly, for the effectiveness, health station voluntary consultation. For the domain of adoption, so among the 9 healthcare workers trained by Project to Class, 7 attended the focus group discussion. 5 were trained and 2 were new on the respective rural health units. And they have utilized technologies provided. They have set up a co-op to class, the teledermatology site, and referred skin consultation with low implementation costs, which shows in the table. And a total of 9,284 per barangay health station or the RHU. And for the domain of implementation, sustained implementation accessible to all, especially to the marginalized population. And it is the facility of choice by patients due to the fear of COVID-19. So during the focus group discussion, healthcare workers have discussed that the training was applied forthwith in their RHU, and their community gladly accepted the project since it is time efficient and economical. Connectivity issues are present during implementation, and the healthcare workers initiate strategies to forward referrals. And they have expressed motivation to use teledermatology, especially those from far-flung areas. And newly assigned staff have shown willingness to learn the use of teledermatology. And lastly, for the domain of maintenance, pioneering communities evidently continued the use of teledermatology. The trained healthcare workers have shown a willingness to coach new staffs. The local government unit supported their health stations implementation through the provisions of internet connection and security, and recommended that the project may be expanded to all barangays of Sultan Kudarat municipality, especially those near coastal areas where skin diseases are prevalent. One factor of sustainability was because of the free antibiotic cream, sulfur, and ringworm ointments provided by Cotabato Sanitarium. And lastly, the consultation to treatment approach. For the conclusion, Project to Class evaluation through the RE-AIM framework shows the feasibility of the community-based teledermatology initiative to be successfully utilized at community health centers and hospitals in the Philippines. However, the participants suggested extending the services to other barangays, especially those more isolated and with the least access to health services. Medication availability for skin diseases is also a concern to complete holistic health accessibility from consultation to treatment. Full integration of the service to the hospital system supported by policies and regulations would also increase the impact on the community. Overall, community-based telemedicine is a low-cost innovation that will provide equitable healthcare access to the whole community, connecting every Filipino to the health system towards universal healthcare. For the recommendations and policy implications, to increase project involvement within the organization, formulate policies to standardize telehealth to hospitals, expand the implementation to other barangays or cities or municipalities, then also include other medical services, and ensure provision of necessary medicines. So that would be all, and thank you so much.
Thank you for that presentation, Mr. Kalim, Ms. Candao, and Ms. Lintongan. For our last presenter, we have Dr. Concesa B. Cabanayan Casasola. You may begin your presentation po.
Good afternoon, everyone. I'll be presenting to you our study entitled Development of Telemedicine to Improve Access to Renal Health During COVID Pandemic. So I'm Dr. Concesa B. Cabanayan Casasola, Medical Specialist in Adult Nephrology Department, and here are my co-authors, Dr. Dangilan and Dr. Simangan. So the National Kidney and Transplant Institute is a tertiary medical specialty center for renal diseases, catering an average of 256 patients per day of face-to-face consultation in our outpatient services during pre-COVID. That's around about 47% with renal diseases and 27% kidney transplant. And last March 15, 2020, we have a cessation of our operation in outpatient service due to the COVID-19 pandemic. And we had a gradual resumption of face-to-face consultation last first week of June 2020. However, only few were seen due to the limited number of patients allowed. Last March 28, 2020, the DOH and National Privacy Commission issued a joint memorandum entitled Guidelines on the Use of Telemedicine in COVID-19 Response. And this, the telemedicine, will provide health services safely during this pandemic. In addition, in May 17, 2020, the Philippine Society of Microbiology and Infectious Diseases released a guideline regarding outpatient clinic resumption. and they recommended that face-to-face physician-patient encounter should be minimized and telemedicine should be considered for patients in whom the risk of getting exposed outweighs the benefit of physician encounter. And these are patients with comorbidities or immunocompromised but are clinically stable patients. We all know that the risk factors for COVID-19 severity includes elderly, obese, diabetic, hypertensive, immunocompromised patients such as the malignancy, and solid organ transplant, CKD, CVD, and these are the patients catered by National Kidney and Transplant Institute. So in order to reduce the possible exposure to COVID-19, our institute, the Adult Nephrology Department, implemented the telemedicine outpatient service for financially disadvantaged renal patients. These are the charity patients. And by telemedicine, we can ensure continuity in delivering renal health services to patients all over the country. So this is our objective, to describe the outcome of telemedicine among financially disadvantaged or our charity renal patients from October 1, 2020 to March 2021. So this is a descriptive study, and with approval of our NKTI Executive Committee, the following were done prior to the initiation of telemedicine. We have to identify what virtual platform to be used, and we used Viber and Messenger because they are the leading social media platforms among internet users in the Philippines as of the third quarter of 2019. We also prepared our physical and technical setup, develop our guidelines, process flow, patient guide, patient consent forms in English and Filipino. We also orient our personnel, our fellows, our residents on website manners and etiquette. Coordination with other services for supervision was also done. A 1-month dry run was done to monitor and polish the process and familiarize the system with the full operation on October 1, 2020. A hybrid model of telemedicine and ambulatory visits was provided. Patient e-survey form was given to assess the patient satisfaction. Since 2012, the Adult Nephrology Department already have the electronic medical records. So during the pandemic, the telemedicine via synchronous video visits was integrated with our EMR. So the following documents are sent through Viber post-teleconsultation: prescription with e-signature, clinical abstracts, laboratory requests, and referral forms. So the following data were collected from October 1, 2020 to March 31, 2021. Total number of consultations per month, total renal patients versus the kidney transplant patients, face-to-face consultation versus telemedicine, as well as the demographics among those who had telemedicine. A descriptive statistics was used. Frequency and proportion was used for nominal variables, median and range for ordinal variables. And these are results. So as you can see, pre-COVID, we are catering about 1,644 to 1,794 per month of renal patients. And during COVID era, that is during the pandemic, we had no consultation in April to May, and we started last June. And from June to December 2020, we have a mean of 326 renal consultation, and from January to March, that's around 807 patient consultation per month. So this is the mean renal consultation per month during COVID pandemic. Last June and July, we didn't have any. And as you can see, as we started, we had our dry run on August and September. And you can see the comparison of total consultation versus the face-to-face and teleconsultation. The teleconsultation is in the red bar, and there's an increase in the number of teleconsultation, around 45 to 80, with an average of 53 increase in renal consultation per month using telemedicine. For the mean transplant consult, that is kidney transplant consult per month during the COVID pandemic, as you can see, there's around a 29 to 42% kidney transplant consultation every month. And that's around the average of 37% kidney transplant patient consultation per month. So using the telemedicine, there's an increase in the number of teleconsultation by our transplant patients. And the average use of teleconsultation or telemedicine by our transplant patient is around 67% increase per month, which is very high for this very vulnerable patient. So in a study done by Concepcion, entitled The Role of Telemedicine in Kidney Transplantation, they found out that telemedicine has the potential to affect and improve the delivery of renal care, replacing or supplementing in-person visits with virtual visits through telehealth and video conferencing, electronic consultation, and remote monitoring and provision of education through mobile technology. They also found the benefit of telemedicine among transplant patients, reduced travel costs, reduced time costs related to travel, and increased work productivity and savings for recipient and caregiver. These are the demographics of patients who had the telemedicine. Majority are on the age of 31 up to 70%, 70 years old. And in a study done in US, of around 148,000 patients to determine what socio-demographic factors associated with higher use of telemedicine, they found out that older patients, Asian patients, and non-English speaking patients had lower rates of telemedicine use. For the gender, majority are male, that is 54%. And for the region, around 59.9% are from National Capital Region, followed by Region 5, Region 4, and some are from Region 7, 8, and Region 3. So telemedicine is a very ideal for our renal patients in the Philippines. This is due to our geography. We are an archipelago, so there is a difficulty in traveling, especially during rainy season. Nephrology and kidney transplant are subspecialized. Majority of kidney transplant centers are in NCR. Telemedicine contributes to the provision of healthcare in underserved areas, and it also facilitates patient consultation during health emergency situations such as this pandemic and disaster. So, telemedicine is well suited for specialty care, including kidney transplant, where patients require travel to centers to see subspecialists who are otherwise not available locally. We did also a patient satisfaction survey, and as you can see, around 76% were first-time user of telemedicine. And the reason why they opted to have telemedicine, majority, 56%, are afraid to go out due to COVID-19, followed by transportation difficulty and long distance in going to NKTI. Others are no other option for consultation. So other reasons are convenient than face-to-face consultation and is less expensive. So the overall patient satisfaction was 95.2%. So it is important to maintain the key quality indicator of patient satisfaction regardless of modality of delivery. The top reasons of cancellation of teleconsultation was poor internet connection, that is 30%, patient out when called, that is 28%, and the patient is already admitted in 13%. So our conclusion is that telemedicine augmented the face-to-face consultation and is another option for this vulnerable population to connect safely with their attending physician. And these are my recommendations. To have a viable long-term telemedicine program, we recommend using one of the traditional telemedicine platforms to prepare us to continue post-COVID-19. To promote adoption, a change management plan must be structured in conjunction with the telemedicine implementation design. Number 3 is to educate the patients and increase public awareness, like a simple guide regarding the limitation of telemedicine versus face-to-face consultation and how they can receive follow-up care if necessary. And in line with universal healthcare, that is to ensure that all Filipinos are guaranteed equitable access to quality and affordable healthcare goods and services and protection against financial risk, we recommend a reliable access in order to that must be supported for patients with low incomes or in rural health areas. So having public internet hotspots for patients with limited internet access or establishing a satellite facilities where patients can be connected with providers at a renal center remotely. We also have to support infrastructure, personnel staffing, and training to ensure high quality care and satisfaction in telemedicine. And lastly, research studies to advance the utilization of telemedicine in the field of renal health are needed. Thank you very much.
Again, thank you for all those presentations. Let us now hear questions from the audience. Our coordinator, Mr. Orven Villaruel, monitored the chat panel and he selected at least one question for each of the presenters to answer. Hopefully, we could find time for additional questions later. Our first question, please, Mr. Orven.
Open for questions na po tayo. Sa ngayon po wala pa pong questions raised. Doc Paola,
Yes, yes, Sir Orven.
mukha wala po yata silang questions. We can proceed na po siguro sa synthesis niya.
Okay
Okay lang
po.
po ba?
Sure po. So, again, thank you po for all those presentations. And to conclude this activity, here's a few words for the synthesis of this session. After we have been plunged into this pandemic, healthcare professionals, as well as the entire health sector, have had to adjust and figure out a way to ensure that healthcare service delivery is not interrupted. Few years ago, though the concept of telemedicine has been fairly new and has already been gradually introduced through apps available and accessible through our mobile phones via the internet, it has not been a norm or it was not a part of our standard operating procedures since clinics are all open for face-to-face consults before COVID-19. Today, we had 3 lectures from our esteemed presenters from different institutions tackling that topic. From the presentations, we have learned that telehealth and telemedicine has been keeping our health service delivery afloat during the COVID-19 pandemic. It has a wider reach and ensures that healthcare services are made available and accessible even to those in far-flung areas without medical specialists, as shown in the second study. However, these advancements are not without struggle. From the first presentation, we learned the importance of having sufficient manpower and stable internet connectivity to be able to deliver quality telemedicine services. Lastly, from the third lecture, we saw that to maximize the benefits of telemedicine, there is a need to establish long-term telemedicine programs in our hospitals, which will continue to augment face-to-face consults even after the pandemic. So with that, we thank the presenters and their respective institutions for all the effort to deliver very informative lectures. And that's all the time we have for this parallel session on telehealth and telemedicine of the Hospital Operations Track of the first National Hospital Week Research Forum. Make sure you are able to log on to your next parallel session on time. And as some of you are aware, there are 30 papers out of 60 presented in this forum that are in the running for the best research paper. The winners will be announced and awarded at the closing plenary session of this forum. We also expect all of you to join then. Before the first National Hospital Week Research Forum formally closes, the link to the post-activity evaluation form will be announced and posted. All those who will be able to fill up the online post-activity evaluation form will receive a certificate of attendance in return. This parallel session has concluded. Thank you for your participation. You may now click on the Leave button or the round X button on the bottom right of the screen. See you all at the closing and awarding ceremony. Thank you.
Hello po. Picture po muna tayo, ma'am. Doc,
Ay, okay po.
hello po.